I'm Dr. LaJoyce Brookshire in studio, up close and personal with you about the alarming statistics of heart disease amongst Black women. I'm giving you this information today from my heart to yours. This is a critical alert in our community, and honestly, Black women's lives matter. I do not understand the silence. So I'm sounding the alarm. I want you to as well. I want you to know that this is so bad, we should wake up thinking about it. Oh my gosh, we should wake up thinking about it. Now, in order to combat heart disorders, what we need to do is have good food and not good medicine. But we need good medicine too, y'all. But we don't need medicine exclusively because good food is our prevention measure. 30 years after the first cholesterol medication to lower cholesterol hit the market, so-called statin drugs have become the largest class of medications in the world, with the United States doubling their use between the years of 2000 and 2010 to reach $20 billion, according to the United States Agency for Healthcare Research and Quality. These are their statistics. Now, while drugs can be appropriate for those already diagnosed with heart disease and who are at a high risk because of stroke, they are not without serious side effects. Okay, statin drugs can cause chronic issues like muscle pain, memory loss, and increased blood sugar, while hypertension drugs can precipitate liver and kidney damage. All right. Now I'm going to toss in there Alzheimer's to boot. All right. Now listen, medically forcing cholesterol down, the cholesterol numbers down to dangerously low levels affect the brain. Medically forcing cholesterol down to dangerously low levels affects the brain. Why? Because the brain is water and cholesterol. Yes. The cholesterol is what keeps the brain malleable and pliable and supple, because when the brain dries out and gets shriveled up, this is when Alzheimer's sets in. Does the passing out, but the doctors are passing out the statins like candy. Yes, they are. True story. My sister was placed on a statin drug when her cholesterol number was just 135. I made her throw them away because she was experiencing a whole bunch of stuff. And I was like, you don't need that trash. What? That's crazy. Do you know that the correlation of statin drugs became prevalent around the time that the Alzheimer's Association was born, around early 1980s? And before Alzheimer's, there was dementia. Mm-hmm. Everybody had dementia. As they got older, that's what happened. As they aged, they had dementia. I'm just saying that Alzheimer's is relatively a new disease since the 1980s, with a strange correlation. Let that marinate with y'all. I'm going to sip my tea for a 2nd. Just saying. Now, Dr. Davies, the executive director of the Chicago-based Staples Institute for Integrative Cardiology, he says that for many patients, there is another way around medications, and most integrative cardiologists agree. Unfortunately, most of the talk about prevention focuses on prescription meds. Yeah. And guess what? He recommends a plant-based Mediterranean diet low in the saturated fat found in processed foods and cheese. That processed cheesed food. Y'all do know that's not cheese, right? When it says cheese food, you don't really know what that is. Y'all know Velveeta's not cheese either, right? The first day my daughter saw it on the shelf, she was like, "Mommy, that says cheese. Mommy, that's not in the refrigerator." Like, no, don't ever eat that. All right? Processed cheese, don't eat it. So, what we should be eating are the leafy greens, the whole grains, the good fats found in fish and olive oil and avocado. Now, these foods have also been shown to lower cholesterol and blood pressure. And I agree with this. We should be embarking upon an alkaline diet. In fact, we're going to put up that we're going to do the alkaline challenge again. Week 1, we're going to do 1 alkaline meal a day. Week 2, we're going to do 2 alkaline meals a day. Week 3, we're going to do 3 alkaline meals a day. And we're going to carry that out through, you know what? I'm going to do it for Lent. I'm going to carry it out through Easter. That's what I'm going to do. That's going to be my commitment to myself. And we're going to post the things that you can eat, the foods that are alkaline and the foods that are acidic so that you can avoid it. Because like I always hashtag, alkaline food will fix it. And it will. Here are some more foods that can help keep your heart in tip-top shape. You can avoid table salt, by the way. And salt gives us a problem. We are resistant to salt, like I said earlier, have trouble with salt because salt is 1/3 salt, 1/3 sand, and 1/3 glass. Yeah. Who's not resistant to that? We don't need that at all. Use pink Himalayan salt or sea salt instead. That's what we should be using. Now, nuts are really good. Nuts are awesome, including walnuts and peanuts and almonds, which have been shown to lower the LDLs, which is the bad cholesterol. And one study that happened in 2017 of 77,000 female nurses was published in the Journal of American College Cardiology, found that those who ate peanuts or tree nuts, including almonds and cashews, 2 or more times a week, had a 19% chance of lowering their risk of developing heart disease. I thought that's awesome. And those who eat walnuts once a week cut their risk by 23%, which is great. So dark and purple and red fruit contain compounds called anthocyanins, and that boosts the production of our nitric oxide and expands your blood vessels, keeps the blood vessels open, and this improves your circulation. Makes a great case for your super beets Karen is always talking about, right? Super beets. Drink your super beets or eat them for sure. Now, one study showed that those who ate 4 servings or more per week of blueberries and strawberries were 1/3 less likely to have a heart attack. That's good news. And another food is pomegranates. Now, I know that pomegranates are seasonal, but listen to this. They are also key for health, with recent research published in the journal of Clinical Nutrition showing a daily serving of juice can make platelets less sticky, which lowers blood pressure and reduces plaque formation. And the dark leafy greens like kale and broccoli, which are rich in vitamin K, play an important role in that. Yeah. And with each serving every week, cutting the risk of heart disease by 23%, according to the Gables Institute. So every time you eat a green leafy vegetable, you cut your heart disease risk by 23%. What? Eat up. Every time. So that was my whole meal last night. That was everything on my plate. I cut my risk by like 90% last night in one meal. Hey, you want to do that too? Oops, and sorry, y'all. And we could do that by eating an alkaline diet, for sure. Now, this one is paramount. Nurturing the emotional heart is equally important. This discussion of heart health would not be complete without an emphasis on social and emotional health. Here we are, laying down the weight, the emotional weight as well. These are critical risk factors, y'all. Critical. And do you know, until recently, it has been largely absent in conversations on heart health? Now, the director of Long Island Jewish Medical Center says, in his research says as many as 90% of heart incidents with women that landed her in the emergency room often shows up in patients with no sign of obstructed blood vessels or high cholesterol. But the factors that landed them there are worries like financial worries, work stress, death or breakup of a loved one. And this can flood the heart with stress hormones, changing the shape of the heart to one that resembles a Japanese-looking pot. What? And that weakens the heart tremendously. Remarkably, though, in many cases, once the emotional state returns to normal, so does the heart. I think that's fascinating. That is like, wow, the body's so awesome. The body gives us signs about what is wrong when you know what to look for. And once you understand the language that the body is speaking, it'll tell you many things. And this is why I'm always harping on prevention. And I pray you all don't think I sound like a broken record, but my goodness, we have to stop dying from things we can prevent. Please, let's. Additionally, when the heart is in distress emotionally, if you feel like you have a broken heart, or if your heart has been broken, there will be a line down the center of your tongue. The center of the tongue is the heart line. Many people who have a broken heart will have a visible creased line down the center of their tongue. And this is an indicator to me and other practitioners that the heart has been broken and has yet to heal. So when we do our phone consultations, y'all have to send me some pictures. And one of them is you have to send me a picture of your tongue. And one of the things I'm looking to see if your tongue is yeasty. I'm looking to see if you have bumps on the tongue in different places, on the side, in the back. You have to stick out your tongue and say, and take a picture for me. And I'm also looking to see if you have a crease down the center of your tongue, because I'm going to ask you who or what broke your heart. It's visible. And then there's always that pause, like, how did you know that? Because the body is a roadmap. But if you got to know what to look for, we've got to heal from these things. We can only stay brokenhearted for so long because now this is attributing to heart disease. And the things that broke our hearts, we're built to last, y'all. And we're built to swallow, digest it, and move on. We are. We are also built to sit in it for a moment so that we can experience it and feel it and learn the lesson. But we are also built to move on. When the emotional work is done, the line down the center of the tongue will go away. And when the heart has healed, or when the acceptance of what caused the brokenness to heal, your heart will too. Isn't that amazing? The body is fierce. This also makes a case as to why you shouldn't pierce your tongue, because you're puncturing a hole in your heart, which means you're buying yourself heart trouble tomorrow. Yes, you are. So when your teenager comes to you and asks for permission to do it, say no. Okay? And if you think you're going to get cute and get drunk and decide that y'all going to go get body piercings in different places and you want yours in your tongue, say no. Think about it. And then not to mention the metal of the earring that you're swallowing with every single swallow that now is going into your bloodstream and settling in your liver that your liver cannot process. Okay? That too. So it's all cyclical. Now, so take out that earring from your heart line, out of your mouth, out of your tongue, so that it can heal, because that hole will close as well in your tongue. It can close, it can heal, but you have to, just like with the ear, you have to take the earring out of the hole and let it heal up. All right. Now, longer-term emotional stress has been shown to lead to platelet aggression or stickiness in the blood. I used to use something called dark field microscope. I had a dark field microscope that, do a little prick on the finger, look at your blood underneath the microscope. And, those are live blood cells. They're live cells. So, you can see the blood moving around. And I was always astonished to see how many people's blood, they were just clumped like in a row, like nickels stacked one upon another. And that's called ROLU. And that means that you have sticky platelets. And a lot of times it is attributed to some kind of emotional thing, in addition to dehydration. Yeah, that has a lot to do with it too. And that impacts the blood flow. All right. And that also impacts the valves on the heart, because when it gets sticky, they can't open and close. It's forcing itself open instead of just opening, closing, opening, closing. It's like opening. Therein lies the difference. So our emotional health is essential for us to be able to have everything moving freely like it should in the heart. Additionally, that also gets sticky because of, the waste particles that are floating around from that filthy colon. Okay? And when the waste and the trash is bouncing all around, that also impedes the valves from operating properly. Okay. Now, while many people are engaging more in their tech jobs, the greatest complaint about that is that it's sedentary work. This is why implementing the practice of doing squats every hour is a good one, and we want to thank Kirk Charles for that idea. And also take a walk to the bathroom. We should, in fact, be going to the bathroom every single hour because we're drinking that water every hour, aren't we? Aren't we, y'all? Yeah. And when you adopt getting up every hour, it will cut back the risk of being completely sedentary while working. Also, being constantly bombarded with stress, the hormones like adrenaline and cortisol can damage the inner walls of the blood vessel with that boosts plaque accumulation. Now, to nurture the heart, integrative cardiologists recommend taking time to maintain healthy personal relationships and minimize work stress, as well as exercising 5 to 6 times per day for at least 30 minutes and practicing activities like mindful meditation or yoga. That has been shown to lower heart rates. Yep. Also, what's interesting is that we should be finding quiet spaces to retreat to and how important that is. A study published in November at the Massachusetts General Hospital in Boston found that living and working in chronically noisy environments can boost the risk of heart problems. That's crazy, because I worked in the record business and the radio business for 20-something years, and boy, is it loud all the time, all the time. Now, this is an issue, of course, though, when you work in a loud and noisy environment. All right. It's also wise to prioritize getting sleep, at least 7 hours of quality sleep at night, and always going to bed by 10 and allowing your body to restore itself in conjunction with that circadian clock. Now, this is something on my Get Perfect Health for Free list that I have presented to you all before, but you can go and listen to it on demand. But sleep is vitally important for the stabilization of blood pressure. We've had this discussion. When you go to bed at 10 o'clock, it allows the circadian clock to be at work because you must be in the REM state sleep, a REM state sleep it takes 2 hours to establish a REM state sleep, and you must be in the REM state sleep to receive the healing. So when you go to bed at 10, and by midnight, you should be soundly into your REM state sleep, then the healing cycle of the endocrine system can do its job at midnight. Now, don't shoot the messenger, okay? I am simply sharing with you this is just wisdom from nature. It is. We cannot defy the circadian clock and its efficacy, because when we don't do work with the circadian clock, we see health issues arise. We see high blood pressure arise. And when I speak in places, I have everyone who has high blood pressure to stand up. Who goes to bed at 9 o'clock? Maybe 2 people will sit down. Who goes to bed at 10 o'clock? Maybe 5 people will sit down. Who consistently goes to bed at later than 10 o'clock? The whole room sits down. I rest my case, because all of you who have high blood pressure, you are consistently defying the odds. Wow. I'm telling you, it has never failed in any room. So if you are chronically staying up late at night, washing the dishes, cleaning the house, packing the lunches, on the internet, studying, stop it. Stop it. Because I know that if you stay up too late, too many days in a row, you will absolutely start to feel a heart flutter. How many of you have experienced that? You feel a heart flutter. All of us have experienced it in college, talking about that crash studying, which is the dumbest thing we ever did in our whole lives. Okay, it never worked for me. I did it once and thought I was going to pass out. Never did it again. Couldn't do it. Always been the sleepyhead in my group. Be the sleepyhead in your group. Your health will thank you for it. So stop roaming the cabin. And you know what? Stop letting your children do it. And stop letting your children see you do it. And a lot of people say, well, it's quiet at night. You know what? Flip the script. Go to bed at night and get up early in the morning. Even the Bible says, Job, have you commanded your morning? We're supposed to meet the morning. Okay? I like to see how many things I can do before it gets daybreak. and I like have a little race with myself. And then when it starts getting light, I'm like, shucks, I want to do one more thing before it got light, because it seems like as it gets light, the day just goes.